Hi, I'm Bex. I'm one of the specialist radiographers working at Royal Papworth Hospital.
Hello, I'm Uchechi. I'm one of the senior radiographers at Royal Papworth Hospital. I'll give you a quick tour of the department.
Follow us.
Welcome to our CT suites. This is one of the 2 CT suites we have here at Royal Papworth Hospital. Bex will be the one to handle for us.
So this is, Uchechi has said, this is our Somatum Flash. This is one of state-of-the-art CT scanners in the country. We're very lucky to have this scanner here. The facility is incredible. So we do a lot of obviously cardiac patients where they have suspected coronary artery disease and they come in for a CT scan, which is less invasive than other modalities that we work in, for example in the cath lab where they will have a cardiac angiogram. CT has its limitations as well, so where the patients may not have, where they have intermediate coronary artery disease, we may not see everything in CT, even though it's still very good, and they may proceed to the cath lab, which you'll see later on. But for these scans in particular, we do the scans in time with patients' heartbeats. So we use what we call ECG gating, where we connect up to 4 ECG electrodes. These are connected onto the patient's chest and we scan within a certain hour-to-hour interval of the heart cycle. I'll not get too technical with it, but basically we can do the scan as long as their heart rate is 60 beats or less in one single heartbeat, which is the coolest thing ever. The scanner table will move very, very quickly, but in order to get that one single heartbeat acquisition, keeping the radiation dose down as low as possible. Here at Papworth, we pride ourselves, we're one of the top for heart flow analysis. So we're doing pretty well. We also have our Ulrich injector pump as well. This is brilliant. It reduces the amount of contrast that we use. We've got 2 contrast pumps, saline, and we've got our single-use patient lines as well. But yeah, this is. We also do procedures such as intervention, so CT-guided biopsies, chest drain insertions, drainages. This is our monitor, as Uchechi's kindly shown us. So everything is displayed digitally on the screen, so for ease of access for the radiologist and the radiographer to look at. We use these controls to move the patient in and out. Various functionalities on here. We've got a mouse cursor as well, which we can measure distances from skin to lesion, for example, for the biopsies for the doctors. It's very versatile. We also carry out CT scans for our ECMO patients, which we have here at Papworth. Also, anyone coming as a primary, for example, having a heart attack, we need to have a look. Do they need to go to the cath lab? If not, they may come to CT. As well as that, we would do any emergencies coming in, someone query aortic dissection, patients that are having valves replaced, we'll do TAVI scans. The list is endless. Any cardiac scan you can think of, that's what we do here at Papworth, and the scanners are the key to being able to do this effectively and as low as dose possible. Welcome now to our MRI suite. This is a 1.5 Tesla and 3 Tesla. MRI stands for magnetic resonance imaging. It is non-ionizing, where the other modalities that we've shown you use X-rays. This modality does not. So where it's contraindicated, perhaps we've got a young patient that doesn't necessarily need a CT scan, they may opt for an MRI scan as an alternative. These scanners are state-of-the-art as well, just like the CT suite that we've shown you. We do a lot of general cardiac scans, primarily the adenosine stress examinations, where we infuse a drug called adenosine to speed up the patient's heart rate. We monitor the patients with an ECG, so we're always got access to their heart rate and their rhythm. We use an additional monitor to keep a good close eye on their observations, whereby we attach a SATS probe to their finger, blood pressure cuff as well, to see any physiological changes in their body. We also use a contrast pump as well, where we have different protocols for different examinations, and we will give what we call Gadovist, which is an iron chelate compound. We have the beauty of the 3 Tesla here as well. We're very lucky to have it. And the strength of the 3T is an interesting fact. It's 60,000 times stronger than the Earth's magnetic field. So it's quite powerful. As a radiographer, our paramount safety is looking after the patients and also any member that would come into the suite, because obviously the magnets are quite strong, so safety is paramount. Every person that comes through has been previously screened. Our patients are screened thoroughly to make sure that it's safe for them to enter the room. Pacemakers and ICDs can be scanned here, depending on their condition. But we've got a proper protocol and system in place for scanning them, and we can scan them. As well as our cardiac patients, we've got congenital patients that need to be scanned as well, our ACHD patients, adult congenital heart defects. We also scan transplant patients, for example, diaphragm screening as well. So not only do we scan the heart, we look at lungs and the odd head scan that we may do every now and again. But these scanners are state-of-the-art, as I say, and it's a pleasure to work here.
Welcome to our X-ray department here at Royal Papworth Hospital. You can see this is a Siemens machine, which is a digital radiography machine. So if I can use my colleague here for an example of how this machine operates. Okay, if she stands here with her arms just for support on the supporting device there, then I'll move this machine and move it up. This is to adjust the height of the patient, and as well we have the collimation buttons. This is to adjust the radiation and let it be on the areas of interest. Yeah. So this machine works in like a tracking system, whereby the both receptor and the image tube work in synergy at the same time. So this machine is used, this particular room is used for basically outpatients, and we also have the other rooms we use for our ward patients. Also we have a machine, that's the portable machines for the vulnerable patients in the ICU and in the ward. So this is the major thing we do here in the X-ray unit.
So as Uchechi is demonstrated in one of our plain film rooms, we also have the facility to use the same equipment for our vulnerable patients up on the wards, on any ward and in particular ICU. So this basically is our X-ray machine. We've got our tube as well. So we aim this when we're at the bed space, aiming at the patient. We've got collimation exactly like in the DR room. And then we take our exposure using the exposure button. This is really useful for our ward patients, those who are particularly sick, and we just portable, move it around the wards, electronically motorised. DR system, image becomes instantaneous on the display and on our machine console. And over to you.
Here we have the Philip CM machine. This is a fluoroscopy machine we use for procedures like our barroom studies and as well cases of bronchoscopy and the theater. Basically, this is for patients that have issues with swallowing. That's what we do here, majorly in Papworth. And to rule out if there's a tumor within the oropharyngeal pathway, to rule out if there is esophageal reflux, and as well aspirations. So this is just what this machine does for us here. And so we have the monitor there, we have the CM, and also we have the touch screen for our buttons. So in many directions, if I can show you, and different angulations, and so that's it. So this here, welcome to ultrasound room here in Royal Papworth Hospital. You can see the ultrasound machines. This is a Toshiba machine, and this is a Sonosite machine. Basically, here in the radiology, our radiologists, that's our registrars and our consultants, are the ones that carry out ultrasound here. And most of the cases we handle here are to see the heart, the soft tissues of the abdomen, and as well we also use it to assess the drains. So it produces a live image of the heart on the screen, and we can use it to assess if there is anything like fluid in the heart, like a cardiac tamponade, and also look at other things. And also, if this is a probe, we can see it's been, placed here on the body parts that's of interest. So if there's any abnormality like fluid in the heart, it comes up as a live image here, and we see it on the screen here, which helps us to assess properly our patients and get very good clinical information that will be helpful in the treatment of the patient.